Imagine someone shaking your shoulder and bringing you to almost a full state of consciousness. For me, it would be 12 times an hour. 12 times an hour, every hour that you sleep. Imagine that should be enough to realize that there's no way you're going to be your best person the next morning.
You're listening to The Successful Bookkeeper with your host, Michael Palmer. Listen each week as inspiring guests share their secrets of success to help you increase your confidence, work smarter, and build a business you love. This episode of The Successful Bookkeeper is brought to you by PureBookkeeping.com, the proven system to grow your bookkeeping business.
Welcome back to the Successful Bookkeeper Podcast. I'm your host, Michael Palmer, and today's show is actually going to put you to sleep. I'm kidding. Our guest is a practicing sleep medicine dentist and author of the book, The 8-Hour Sleep Paradox. He is a TEDx speaker, and his advice regularly appears on media outlets like CNN, CBS, The Washington Post, and Men's Health. Dr. Burhenne, welcome to the show.
Thanks, Michael. Actually, my job is to get people to sleep, but we won't do that today, promise.
That's right. Well, we have a lot of listeners that drive while listening, so you may want to pull over to the side of the road. I can't, you know what, these jokes are going to get old, I'm sure, but it's great to have you. It's great to have you, Mark. And sleep is a huge problem, and I actually suffer from poor sleep. I have for the last probably decade, and I used to sleep like a baby. So this episode may very well be just for me, and I'm looking forward to it. But before we get into all of that, tell us a little bit more about yourself and your career journey leading up to this point.
All right. Well, I've been a dentist in the U.S., in California, Silicon Valley, for about 34, 35 years. And halfway, was a conventional general dentist, loved it. And about 10, 12 years ago, realized that I had sleep apnea, my wife had sleep apnea, then very likely my children, we can discuss that. And that kind of turned me around in my career. I mean, I continued doing dentistry, of course, but I can't technically diagnose sleep apnea. That's in the realm of a physician. But it was so easy for me to see and recognize sleep apnea after having treated myself, my wife, or gone through the process of treating ourselves with physicians' help. I realized that I was in the perfect position to recognize sleep apnea decades. 20, 30 years before a physician could recognize it, or even a patient, self-recognition of the problem. So, my daughter and I discussed that. She has a little bit of what's called upper airway resistance syndrome, which is kind of a lighter version of sleep apnea. And we decided to write a book on it. And ever since then, I've been practicing sleep in my dental practice. And that's kind of where it all started.
That's amazing, and such a wonderful narrow message to wrap around your practice. I'm sure it's been good it's a differentiator really for your business.
Oh, it has been, and we get a lot of sleep patients, a lot of referrals actually from all over the world, and actually the best part is it's so gratifying to get someone to wake up and during the day and sleep deeply, and so that's been really a lot of fun.
Yeah, that's a gift to give somebody. I appreciate when I have a good night's sleep and it's just like magic, right? When I don't get sleep, the world starts to darken, and I think it's Macbeth. I think it was Shakespeare's Macbeth where he talks about sleep is, cures all of man's ails, right?
You're right. I think we used that quote in the book. I think, yeah, you're right. Yeah. Even Shakespeare knew the value of sleep.
Oh, yes. And so when you talk about sleep apnea, I hear about it all the time, and I kind of know what it is a little bit, and I'm maybe wondering, what exactly is it?
Right. Well, everyone has heard the term. It's in the media, obstructive sleep apnea, maybe less so, but sleep apnea is a pretty recognizable term, but I don't think a lot of people really know what it is. And I think when they read that or see that term, they kind of think, well, that's not me, because even they know what the solution is, and that is wearing a mask with tubes that's connected to a box, by your bedside, and that right away is a huge turnoff. So very simply, sleep apnea is a situation where our airway, which is so important, other than being able to swallow food. It's essentially allows us to breathe. And, after a minute and a half of not breathing, we're done, right? So it's a very vital thing. It's essentially where that at night collapses and becomes an issue and restricts your breathing. And actually you stop breathing at night. And those are apneas, hypneas, reras. These are all different types of low breaths or no breaths. And that there alone should scare people. And we are very prone as a species to experiencing this. And not only because we're upright and we've evolved into that position, which gives us that little right angle turn or kink in the tube in the airway, but also on top of that, because of a lot of epigenetic factors, like air pollution and less breastfeeding. And there's a host of things that have contributed to our environment in the last 200 years that has made that situation, the fact that we are upright, even worse. So our airway is in danger at night because of who we are and where we live and how we live. And that should be the message right there. You are not breathing at night. Your brain is suffering. You're not getting enough oxygen to your brain. And thank goodness our body wakes us up when that happens. And that's the crux. We keep getting woken up by this situation, this condition. And that's why we're tired. Imagine most people can have 12, 15 interruptions where the airway collapses and you wake up because your body is scared, fight or flight response. Most people have 15 to 75 interruptions per hour if they are diagnosed with sleep apnea. I had 12. My wife had 35. My young, healthy, thin, active daughter, actually 2 of my 3 daughters had AHIs of 5 or 6. That's still not a good thing when you're young. All that adds up to just being tired. Imagine someone shaking your shoulder and bringing you to almost a full state of consciousness. For me, it would be 12 times an hour. 12 times an hour, every hour that you sleep. Imagine that should be enough to realize that there's no way you're going to be your best person the next morning.
No, absolutely not. You've mentioned your daughter. This can be a problem because many people would think that, yeah, it's a medical condition. You see your doctor about it, but I don't have this. I wake up like I'm thinking of myself, right? I have no idea. I wake up in the night, sometimes multiple times, and I think it's just because something's on my mind, but I don't know. Maybe it's something different.
The way I explain that, and I have a lot of patients that I treat for insomnia, and that's a tough one, but if you are in a light stage of sleep, like we call that the N2 stage, a lot of people people that are suffering from sleep apnea, narrowing airway, they will spend a lot of time in a light stage of sleep because they can't go to deep sleep. Deep sleep is where the airway collapses. So your body pulls you out, you're tossing and turning. If you are in that, related to what you just said, if you are in that light stage of sleep, and that would be tossing and turning, looking out the window to see if the sun is coming up. Being aware, checking the clock, going to the bathroom, rearranging your pillow, thinking it's too hot, too cold, noticing that your partner is snoring or not or moving. That's that light stage of sleep. Then you will have time to think about, what happened the day before or what's coming in the day ahead. So if you were in deep sleep, you wouldn't have a chance to think because your brain is in a completely different stage of awareness, and that's essentially no awareness. You mentioned earlier in the podcast, sleep like a baby. Babies do sleep a little differently than teenagers, and teenagers sleep a little differently than adults. But sleeping like a baby is amnesic. In other words, you go down, you wake up, and you remember nothing in between, and you barely move. That is a optimal stage of sleep, and you feel refreshed the next morning. And the problem is this happens so gradually. As we get older, the airway is more likely to collapse. Life, hits us hard. We stay up late. If you're a bookkeeper, for example, I would imagine that most of the work is done late at night. So you're in front of a blue screen, which can change the state of your brain and keep it active all night, even though you're trying to sleep. All these things contribute to slowly and very insidiously, without really realizing that the next day and the day after and all the days ahead, you're just not feeling 100%, but you really can't redirect and go back to your sleep and say, that's what's happening. We use old age as an excuse. We use stress as an excuse, or I went to bed late last night, or I drank a glass of wine too close to bedtime. We have all these great excuses when really we should be looking to assessing our airway. And in the book, I write, no matter what, everyone should be assessing their airway at a very early age. I've got little infants that I already know have sleep apnea. The problem with that is that the test, the sleep study, the attended sleep study, the PSG, the polysomnography that is the gold standard for testing sleep, is prohibitively expensive. And insurance companies push back. Even primary care physicians push back on that. So that is the issue. It sneaks up on us very, very slowly, and we're not aware that it is the crux of the problem that we have, that we are tired and not functioning 100%.
Wow. Well, it's certainly got my attention. And, when I say sleep like a baby, I've got a 13-month-old, and it's almost become a joke, right? It's like they don't sleep so good at times, but always waking up.
Right.
But you mentioned, and we said sleep medicine, you're a sleep medicine dentist. And what exactly is a sleep medicine dentist? Is there actual medicine how do you solve this problem?
Right, that's a good question. So there are organizations, I think the best one is the AADSM, American Academy of Dental Sleep Medicine. So essentially it is a dentist who is looking for, screening for, and is part of the treatment process in one area, that is the oral appliance, in the treatment of this medical condition. So it is a dentist in a very narrow scope practicing medicine. And I think it's great that the physicians have realized this. It's actually a group of dentists and physicians, and they have realized that, because the oral appliance has come back and we have good data on it and it's become popular for mild to moderate sleep apnea, it's a great solution. You don't have to wear the mask and have the box next to you and plug it in and hear that crazy pumping noise and all that. The oral appliance has come back in a big way. So the physicians realizing that they don't know enough about the TMJ joint and the teeth and appliances and delivering appliances into the mouth, into a patient's mouth. So they have now teamed up, dentists and physicians work together. And if a physician writes a prescription for an oral appliance, the dentist will fabricate this device. So it's kind of a combo, but it's a very narrow scope. I'm not practicing medicine by any means. And it's clear that that's beyond my scope, as it is for a physician trying to make these oral appliances or making decisions and diagnoses based on teeth condition, tongue condition, that kind of thing. So it's a rare collaboration between medicine and dentistry. Dentistry and medicine separated back in I think it was the 1840s or 1850s. And that was a huge mistake, because oral health is integral to overall health. So, but this is the one clear, good working example of how physicians and dentists collaborate for the betterment of the patient.
It's fantastic. And I would think that many people, the solution for getting more sleep is to take a medication, right? You're talking about a preventative appliance that you're putting into somebody's to correct or help the airway. And I would think, what has me thinking, if you take a medicine like a sleeping pill or something that's going to help you knock you out and you have a problem with your airway, that's probably dangerous.
Right. Yeah, Ambien is the best example of that, and I've taken patients off of, probably hundreds of patients off of Ambien slowly, and Ambien actually makes sleep worse. Yes, it does knock you down. I think the worst part of someone that has insomnia and doesn't sleep well, stays in those lighter stages of sleep, is that tossing and turning. The analogy I use, it's like camping. That's the worst part of camping, is you're sleeping on the hard ground and you're not sleeping well and you're waiting for the sun to come up so you can continue your camping trip. The Ambien can knock you out so that you're not aware, but it actually inhibits the body from reaching and staying in deep sleep. So it actually makes sleep worse. It just makes you think that you're doing better. So it's very deceiving. So I would recommend not going that route. Fix the root cause. Do not treat the sign or symptom of restless sleep. Treat the root cause. That is what is causing you to, toss and turn.
Absolutely. And I agree with you. There's something about our body has come up with a way to have us. And I would say that, as a young person, as I mentioned, I slept much better. And And there's just such a difference with that real, when you've had a great, natural, deep sleep, and it's like, well, how do I get back to that? You mentioned that. It's like that. It's like crave that, because the world looks different with that type of sleep. Right. So there's no, until they've invented some magic pill that gets us there, there's nothing that replaces actually the fixing the root cause, as you say. And with every problem, go into the roots cause, pardon the pun there with the dental, but going to the root cause is going to be good. Now, our listeners are very busy. You mentioned it, bookkeepers, they're bookkeeping business owners. There's probably not a lot of sleep going on well. What can you offer to help them get on a track to better sleep?
Right. Well, I think I mentioned one thing. Let me first say that I employ a bookkeeper for my dental practice, and she's invaluable. I couldn't do it without her. I think in the family, we also employ a bookkeeper. And I just have spoken with them many times, and I picture them and know that they sometimes will work late at night. And of course, everything's done now by computer. So that was the first thing I mentioned. Those late nights with the blue screen on, that is, I think as a younger man and having sleep issues, I underestimated the effect of blue light. And so I would, if you have to do that, which it probably is true, that's necessary, get some blue blockers, get a good pair, invest in a good pair of glasses. You can still see your screen, but your body, your brain is not seeing that blue light. I think that's very, very important. I think that would be my first tip. The other tip is absolutely, no matter who you are, get your sleep verified or tested. I use the word verified because, you may already be sleeping well, but verify that fact. And then even if you get treated with sleep apnea and you have your oral appliance or your CPAP or you've had surgery, keep verifying sleep. Don't think it's fixed, because it changes as we age. I think most bookkeepers are self-employed. Maybe they don't have a great insurance plan. They typically will have a very high deductible of $5,000 to $10,000. Well, the sleep study is $3,000. So I would feel bad. I feel bad for my patients that get a sleep study and they have to pay that amount of money. So maybe if sleep issues are a low probability and you're young, then maybe just, for example, get a Oura Ring. I mean, there are multiple devices that will test sleep, but you could, for $200-300, buy a device that gives you some indication of how you're sleeping. The very simple way to do this, and it's not foolproof, but it is for the cost of downloading an app for free, can be very effective. And that is, download an app like SnoreLab, which is a free app, the non-professional version, and sleep alone in a comfortable room, dark room, optimize your sleep area and sleep alone for a few nights, and just put that by your head, by where your head is on the bed, on a steady surface, like a night table. Turn off the go into airplane mode, and it just records you. And let's listen to what sounds you're making. You can also buy these internet cameras. I've tested those. You can buy a little camera that you can see at night and watch yourself sleep at night. You'll be surprised. Maybe you're going to the bathroom in the middle of the night. That is a comorbidity of sleep apnea. Maybe you're moving around a lot. Maybe you're not. Looking at yourself is very effective. That's $100 test in a way. So there are other ways other than getting that sleep study. But if you feel you're tired during the day, you are going to the bathroom a lot in the middle of the night, you're getting up, you're sleeping lightly, that, you have high blood pressure, you're craving carbs, or you have insulin resistance. I mean, if you have any of those symptoms, and I list all these in my book, I have these little checklists. That way, it was written for a person wondering, do I have sleep apnea? And should I get that test? It's just a quick read where it can quickly give you an idea of what you should do. Go through that process. You can do this online. There are websites that will help you with this. Then if you are high on that list of comorbidities, then you do need the PST. It's worth the investment. So the trick is to know what your sleep status is, and everyone should have an idea of that.
I love this. Well, I can really hear that. The first step is the 8-hour sleep paradox, the book that you wrote. There's lots of checklists and understanding. I mean, that's barrier to entry there is the cost of a book. That could be the best investment anyone makes. by starting this journey onto sleeping better, because I know, and I know our listener knows, you improve your sleep, you improve your productivity, you improve your satisfaction of life. That all returns, the ROI is just on and on and on it goes.
It's huge.
Right. What better? The world just becomes amazing, our oyster, if we have a good night's sleep. So I'm big on that, and I want our listeners to be big on that. So I will definitely be buying the book. There'll be a link to buy this book. And then you mentioned a couple of other apps and whatnot. We can put links to those as well. But you mentioned very briefly the Oura Ring, and it kind of sparked something that a person had told me about the Ring. And I just kind of went and looked at the Ring, and it was like, wow, that's an expensive app or device. Talk a little bit about that, because, when you talk about a sleep study at $3,000, the Ring became very inexpensive, right? If it's going to solve or help to solve a problem.
Exactly. Well, I'm in no way financially compensated, by Oura Ring. And it was very hard for me to get one, actually. And I've tried a lot of different devices. I've glued things to my forehead, wristbands, chest straps, pads underneath the mattress. The reason I test all these devices is typically because companies reach out and send them to me. I know my sleep very well because I've had several PSGs. I have this device that if I take out, I have 8 to 12 interruptions per hour. If I put it back in, I have 0. So I have many ways of testing sleep, from a personal level. I even test mattresses. But Oura Ring never reached out to me. I reached out to them because of what I was seeing and what they were testing for. And they have a very unique way of looking at sleep. So it's convenient. I'm not a big ring wearer. I mean, I have a family ring and a wedding ring, and I don't mind watches, but they think the ring is the way to go. But the measurement is accurate. They do some unusual things. The ring will even pick up the differences between mouth taping and not mouth taping. A few weeks ago, I was up in the mountains and had a congested nose and couldn't tape. So it even picked that up with resting heart rate, resting respiratory rate. It does work. It is, in terms of comparing one night to another, it makes a big difference. So it at least allows you, the wearer of the ring, to, sounds like I'm talking about a Tolkien book here, right?
The ring, or the one ring to solve the win them all. I forget how it goes.
Exactly, or to solve the issue of sleep. But anyway, it does work. It has some benefit. It also measures heart rate variability, which is an unusual way of measuring sleep and body temperature. And so it doesn't measure, like your SpO2, that's the oxygen saturation. But you don't need to have low oxygen saturation in your system to have sleep apnea. You can still be having interruptions. So it's currently, and has been for a while, it is my best way right now of testing my sleep at home without having, all these gadgets or going into an attended sleep study at clinics. So I think it is $300. You have to wait 5 to 6 weeks. You have to size it properly. You have to wait for a sizing kit. I actually keep a sizing kit at the practice. That way that saves the patient a week or two of waiting for that sizing kit to come. And it is a ring. I mean, rings sometimes don't come off when you're a little swollen, right? Early in the morning. So size it correctly. They give you very good instructions on how to do that. And it is an expensive ring. Compared to jewelry, it's cheap, right? I mean, most people are wearing more expensive rings than that. So I do like it. I do recommend that you are thinking and monitoring and, being mindful about your sleep. And this device, and again, I'm not a big wearable guy. I don't like wearables. I don't like all the gadgetry. I'm anti-gadgets, but this device does work. And, I wish they could pay me to say that, but it's okay. It's great. It's a really, awesome. Right now it's the best we've got, if just shy of going in and spending, all that money to get a sleep study. So, and it's something that you can do daily. I mean, I've worked with other companies. I've helped companies go to market with products. So we've had infrared cameras that will watch you breathe, that can look through the sheets and through the clothing to see respiratory rate, heart rates, and there are lots of great devices out there. Patches with accelerometers in it, SpO2, the blood oxygen saturation, known as pulse oxes, pulse oximetry devices that are available to the public. Again, you don't need to have low oxygen to actually have sleep interruptions. So the Oura Ring right now works. It's not perfect, but it's the best we've got. So that's a great place to start.
Yeah, it sounds like it. And I mean, hearing you talk about it and friend of mine mentioned it. And so this really is interesting for me. I'm sure it's very interesting for our listener right now as well, thinking, gee, when you start to compare it against it, like anything else, right? You look at, oh, gee, I got to, pay. I mean, I'm going to transition into talking a little bit about oral health here, but you think, oh, I got to go to cleaning, and it's like, whatever it costs, and but wait a second, it's like cheap compared to the outcome if I don't do it, right? We often, I will blame myself, I'll point the finger at me. It's like sometimes I balk at a cost, when really it's the best investment I could ever make in terms of what's the bigger problem if I don't do this, like this ring, right? What's sleep worth?
You got to look at the ROI, right?
You got it.
That is simple enough, yeah.
Yeah,
and it's huge.
But hearing you talk about it and being, it just increases it reduces risk now to say, yeah, you know what, this is not some gimmick. It's actually being used, and it's being used to solve a problem. And if we can have better sleep, we've already talked about it. It's big deal. Let's talk a little bit, and thank you for sharing that. And I'm sure listeners will reach back and let you know if they've gotten the Aura ring, how it's worked out for them, and let Aura know. Aura, if you do buy a ring, let Aura know. Right, you heard it from right. Yeah, Dr. Mark,
Dr. B. Right.
Yeah, there you go. So let's talk about oral health. You're a dentist. I mean, that's the work you've been doing, and yet that your practice is around helping people get to better sleep. But oral health is in itself, as you already mentioned, very important. What should we be thinking about as, our listener is probably not thinking every day about their oral health. Maybe they are, but I brush my teeth, and, you think you're doing everything you need to do. But what do you have to say about that?
Yeah, well, that's a great question. It's a very important one, because oral health, as we're finding out now, finally, thank goodness, has huge impacts on your systemic health. So overall, I would just say, to answer that question simply, I would say, do not underestimate what poor oral health can do to you in your life. It could literally kill you, and not in the classical sense of having a tooth infection. It could lead to early onset of Alzheimer's. There are bacteria that are released during that autoimmune kind of reaction, gum disease. That immune system is very active in the mouth, because teeth, literally, it's the only place in the body where this happens. Teeth stick out of the body. I mean, they come out of the inside of the body and stick out and are in function. And keeping that clean, that area, that little barrier where bacteria can slip in and cause systemic infections, is a very complicated area. The mouth is very complicated. It dries out. pH changes are pretty wild compared to the gut. We can abuse our mouth so easily by grinding, chewing, putting weird foods in there, and burning our palates with hot foods and microwave foods. So it's a very unique place that needs a lot of attention. And if you don't give it that attention, for example, that autoimmune response, cytokines are released. They actually produce this. We've just discovered 6 months ago. They released this substance called a gingipan, and that travels through the bloodstream, within days, and crosses the blood-brain barrier, goes into the brain, and the brain goes into this mode of laying down the amyloid plaque, which is the beginning of Alzheimer's. So do not, when your dentist says you've got deep pockets, you've got gum disease, your gums bleed, you're at home brushing your teeth or flossing, you see a little blood, that's not a normal thing. You take that very seriously. I think when we spit out in the sink after we've brushed and we see a little blood, most of us are like, well, that's just because I brushed hard and my gums bleed. No, that is a signal that you are having this autoimmune disease, this inflammatory disease, this reaction of the immune system to try and control this infection, control the bacteria from entering the body. It's a serious thing. So the only way you can really do that is regular visits to the dentist. And so I think finding a good dentist and having a long-term relationship with the dentist and the hygienist is key, is the consistency of care and the measuring of pockets. And if there are deep pockets, dealing with it. There are a host of other things that you could be doing. There's nutritional advice your dentist can give you. A lot of us are deficient in so many areas. We're using the wrong toothpaste, the wrong mouthwash. We're using mouthwashes that actually is the equivalent of carpet bombing the bacteria in the mouth, which is the last thing you want to do. If I were to say one thing, and this is recent, if I were to say one thing about what to one thing that could really help people change their perspective about what happens in their mouth, happens in their body kind of concept would be to read the book, Heal My Oral Microbiome. And we'll put that into the show notes. It's a very simple read. It's short. It's written by someone I know who has done a fantastic job on, and in fact, I give this book to dentists. I just gifted it to my dentist, and because dentists need to look at it this way. It will alter how you see your mouth, and it will make you realize that a lot of these toothpastes that we're using, the big brands, mouthwashes, the brushing techniques, foods that we eat, diet, all of these things, it's the wrong approach. So I would read that book. It's a fascinating book. It's a quick read, and it'll teach you that the mouth is meant not to be disinfected like we do with our, alcohol-based mouthwashes. It's something that needs to be nourished. It is the opening of the GI tract. It is the beginning of the it is the beginning of the gut microbiome. It's intertwined with the gut microbiome. It can have effects on your brain, as I've mentioned earlier, heart disease, cancer, all these things. So I hope I don't want to use the word scare, but I hope I motivated a lot of people to really, okay. Well, that's not what we're supposed to be doing. We're not supposed to scare patients.
Fear is not a bad motivator. Hey, wait, maybe a better way of saying is like a wake-up call. It's a good wake-up call of like, hold on, wait a second. I have not been paying attention enough to this. And I go to the dentist pretty regularly, and it's not one of those things. I don't mean there's no drilling or anything happening, and I have pretty good teeth and all that jazz. And yet it's like, I got to go to the dentist. But yet, this is a great way to reframe it to, hey, this is like leading to a better brain, a longevity, feeling better. Like this is what my dentist was saying too. He didn't get into it as deeply as we're having the opportunity to do now, but there's a lot of things going on that we didn't know, that if we take care of this stuff, it takes care of all these other problems that are a lot harder to take care of. So this is an easier one. If we can take care of our oral hygiene, it leads to great things. So it's definitely fear, but it's like, gee, is this happening to me? I don't want that to happen to me, but it's a wake-up call. Pay attention to this, right?
Right.
And the book you mentioned, the micro, I want to make sure that we get this book.
Yeah, it's called Heal Your Oral Microbiome. It's written by Cass Dooley Nelson, and it's wonderful. It should be required reading for all dentists. I'll just start there. Because it'll change your perception of what the mouth is doing, what it's all about, and therefore you will know what the right thing to do is for your mouth. And if you can take care of your oral health, a lot of other things will fall into place. And as you've heard me speak, she doesn't mention this in the book, but oral health and the oral pharynx and nasopharynx, that's further down. If that gets constricted, you've got sleep apnea. So a lot of stuff happens in the head and neck region, and if you're not on top of it, it can really take you down very, very fast and change, the course of your life. My daughter and I not jokingly, but, we'll say that your airway is your destiny, and your oral health is your destiny, and it can determine so much. And people in the 1700s were dying from just a simple tooth infection. So I also say that tooth pain has shaped world history. A lot of leaders like Stalin, Hitler, they had terrible teeth, and I've seen patients come in, and these are, cogent, smart CEO, successful people. They are on their knees with tooth pain, and they can't focus. And imagine having, sleep apnea and undiagnosed, and you're driving down the road. You're a threat to other people as well. So what happens in the head and neck region can really be your destiny. It's that big of an issue.
Wow. It's so interesting. And if I lived in Silicon Valley near you, you'd be my dentist, 100%. Thank you so much for sharing all of this and giving us a wake-up call, not only for our sleep, but also for so many other ailments that we can avoid. And like you've given examples, life will be much better for all of us if we take care of these little things that we have control of, and will lead to bigger outcomes for all of us.
Absolutely. Thanks for having me on the show. And again, real quick, thanks to my two bookkeepers. You know who you are. Thank you for all you do.
Beautiful. Thank you. And it's always great to hear the client of the bookkeepers, right? That you listener, you make a difference, a really, really big difference, and you help people like Dr. Mark here do the work that they do, which is really remarkable. Your bookkeepers are helping you have the time to actually go out and help solve these really, really big issues. So I always like to say,
true.
That's the thing to focus on. It's like who you're helping. You're doing your part to help the greater good. And so love it when we're able to help small business owners like yourself. So this is great. Loved having you. And I know a lot of people are going to have better oral health and better sleep as a result of this podcast.
Thanks, Michael. Appreciate it. Have a great day.
Yes, you too. And with that, we wrap another episode of the Successful Bookkeeper podcast. To learn more about today's wonderful guest and to get access to all sorts of valuable free business building resources, you can go to thesuccessfulbookkeeper.com. Until next time, goodbye.
You've been listening to The Successful Bookkeeper with Michael Palmer. For more information and to download the resources mentioned in this episode, please visit us at thesuccessfulbookkeeper.com. Thank you for listening.